What causes heart attacks? Well, our understanding of what causes heart attacks has radically changed over the last 15 years. If we look at the picture here, this is a picture of the heart showing in red the coronary arteries. The coronary arteries bring oxygen and blood down to the heart muscle from the aorta. Now, if we look inside the coronary arteries, looking straight into them, this shows the buildup of cholesterol in the coronary arteries over time. We start out with nice clean arteries with no cholesterol, and based upon our blood cholesterol level, whether we smoke, whether we have diabetes, whether we have a family history that makes us genetically predisposed, cholesterol will deposit in the coronary arteries. This shows a 40% blockage. If there's a 40% blockage with the cholesterol here filling up partially filling up the inside of the artery, there's still enough space here for blood to flow through into the heart muscle. What we now know is our old model of what caused heart attacks and heart disease is wrong. Our old model was that there was a gradual buildup of cholesterol, 50, 60, 70, 90%, until the artery was closed. That's not what happens. What happens is this 40% narrowing will suddenly become inflamed. And if it becomes inflamed, if there's inflammation here, the cholesterol that is on the wall, in the wall of the artery, will break through into the bloodstream. When that happens, a blood clot forms and you have a heart attack. Now, if we look at this, here's a 70% blockage. This 70% blockage is limiting the blood flow to the heart muscle. So there's not enough blood flow here to nourish the heart muscle. This will show up on a stress test. On the other hand, if you have a 40% blockage, there's enough room here for the blood to flow through. This will not show up on any stress test, whether it's a nuclear stress test or an echo stress test. Now here's the key point. The key point is this non-obstructing cholesterol accumulation causes 70% of heart attacks, which are called MIs. So 70% of the heart attacks that occur are due to these non-obstructing cholesterol accumulations, we call them cholesterol plaques, that cannot be picked up on a stress test. The ones that are picked up on the stress test, the cholesterol accumulations that are 70% narrowing the diameter or more, only account for 30% of heart attacks. So, how do we detect these 40%? What we do is we look at the amount of calcium deposits in the 40% non-obstructive cholesterol accumulation, and we do blood tests looking for markers of inflammation that tell me that this non-obstructing cholesterol accumulation is likely to pop open. Now, this is illustrating exactly my point. If we look at this diagram in red, we see the coronary artery, and if we focus on this picture, this is a picture showing the cholesterol on the side of the artery and the blood flowing through to the heart muscle. What happens when a heart attack occurs is the cholesterol in the inside of the artery will break through due to inflammation, and that cholesterol, when exposed to the bloodstream, will cause a blood clot. This is a heart attack. There's no flow down here whatsoever, and this is what causes a heart attack. So, the medications that can prevent this are the medications that stabilize this cholesterol accumulation on the sides of the artery and prevent the cholesterol from popping through. In other words, preventing like we prevent a pimple from bursting. But here, when the cholesterol pops open or bursts open, it's popping open into the bloodstream and causing a heart attack to occur. This is what cholesterol-lowering medication does primarily. It stabilizes the cholesterol in the walls of our artery. And in some cases, if we aggressively lower the cholesterol with medication, diet, and exercise, we can actually shrink these blockages. This is the current understanding of what causes heart attacks, and it's dramatically different from our understanding of 15 or 20 years ago.